As lockdowns eased and recovery began, the immediate fear of collapse receded. Hospitals stabilized. Movement returned. Daily life resumed its rhythm. But emergency spending did not disappear with the virus. Behind the visible recovery, financial records accumulated. Relief funds, procurement contracts, health insurance reimbursements. The documentation was extensive. Audit findings continued to surface. Not dramatic declarations, but formal observations. Requests for clarification. Flags requiring explanation. As attention shifted from survival to review, scrutiny intensified. And one institution stood at the center of that review. PhilHealth, the National Health Insurance Agency, tasked with supporting hospitals and citizens during the most demanding public health crisis in recent history. As reimbursements moved quickly to sustain the healthcare system, questions followed about management, compliance, and process. Emergency urgency had accelerated operations. Now, explanation was required. The crisis had demanded speed. The review demanded clarity. And once again, the tension between action and accountability moved to the forefront. As the country recovered, the emergency gave way to examination. And the next headline began to form. In 2020, as the country focused on pandemic survival, a different kind of concern began to surface. It did not begin with a disaster. It began with internal disclosures. A former official publicly alleged that systemic irregularities were occurring within PhilHealth. The claims included misuse of funds, questionable reimbursements, and procurement concerns. The language was serious. The numbers were significant. The allegations quickly entered the national conversation. News outlets reported the claims. Public reaction intensified. At a time when healthcare funding was critical, confidence in the institution became central. Legislative hearings were scheduled. Officials were summoned. Explanations were requested under oath. The focus shifted from pandemic logistics to institutional integrity. The timing intensified scrutiny. Hospitals depended on reimbursements. Citizens depended on coverage. The institution stood between public funds and public health. The allegations centered on overstated claims, procurement irregularities, administrative weaknesses. These were claims, not conclusions. In crisis, trust becomes currency. And when questions arise around that trust, attention returns quickly. As emergency response gave way to examination, PhilHealth became the next center of focus, not because the pandemic had ended, but because the spotlight had shifted. The allegations moved from press conferences to formal inquiry. Senate committees convened. Officials were called to testify under oath. Documents were entered into the record. Lawmakers asked direct questions about reimbursements, about procurement processes, about internal controls. The language shifted from accusation to documentation. Officials responded with data. They described procedural safeguards. They cited compliance with existing rules. They emphasized the extraordinary pressures of pandemic conditions. Some explanations were accepted. Others were challenged. Certain figures were clarified. Others remained disputed. The hearings became technical. Commission on audit findings were referenced repeatedly, not as verdicts, but as bases for further inquiry. Observations required response. Responses required verification. As days of testimony continued, the intensity of attention fluctuated. Headlines summarized exchanges, clips circulated, but the full record remained lengthy and procedural. By the end of the hearings, no single narrative prevailed. There were admissions of administrative weaknesses. There were defenses of institutional compliance. There were commitments to reform. The process had unfolded publicly. Questions had been asked. Answers had been given. But clarity, as often happens, remained layered. As hearings concluded, attention shifted from testimony to action. Administrative responses began to unfold. Resignations were tendered. Certain officials stepped down amid heightened scrutiny. Leadership adjustments signaled institutional reset. Investigations were initiated. Task forces were formed to review procurement processes and reimbursement claims. Administrative and legal reviews proceeded with informal channels. Oversight moved from inquiry to evaluation. The focus shifted from allegation to evidence. Reform commitments were announced. Stricter verification procedures, improved internal audit systems, enhanced compliance mechanisms. Institutions respond by tightening structure. Operational continuity remained essential. Hospitals still required reimbursement. Coverage still required administration. The system continued functioning, even as review unfolded. Some cases proceeded further. Others remained under examination. The legal process by design moves deliberately. By the end of the immediate cycle, administrative changes had been made, investigations had been launched, reforms had been promised. But as with crises before it, the question shifted from what was alleged to what would endure. In the months that followed, internal reforms were introduced. Verification procedures were tightened. Documentation requirements expanded. Digital systems were strengthened to reduce vulnerability. Claims processing became more layered. Approvals required additional review. Compliance thresholds were clarified. Administrative safeguards were emphasized. Oversight did not disappear. But as immediate tension subsided, public visibility decreased. Technical updates replaced headline coverage. What once dominated conversation returned to administrative routine. The reforms continued. The urgency did not. Subsequent audit cycles reflected adjustments. Some concerns diminished. Others evolved into procedural matters. Institutional change, when it occurs, is gradual. For many citizens, the controversy receded from daily awareness. Healthcare services continued. Coverage remained active. The system moved forward. And as new issues emerged in national conversation, the focus shifted once more. Not because the past vanished, but because attention relocated. The system adjusted. Reforms were recorded, but whether transformation occurred or simply recalibration became harder to measure as the next headline arrived. As the pandemic eased and public life regained rhythm, attention moved forward. New issues surfaced. New debates formed. The national conversation did what it often does. It shifted. The PhilHealth controversy, once central to daily headlines, gradually became an update, then a report, then a reference. It joined a growing archive. Pork barrel, Yolanda funding, Mama Sapano, election realignment, war on drugs, COVID response. Each moment intense, each moment urgent. The process did not stop. Investigations continued. Administrative adjustments remained in place, but visibility faded. And without visibility, urgency declines. Time layered over controversy. Recovery layered over scrutiny. Normalcy layered over alarm. The pattern returned, not through erasure, not through silence, but through replacement. A nation cannot focus on everything at once, and so attention selects. What it selects becomes urgent. What it leaves becomes procedural. And so the question returns once more, not whether controversy occurred, but what remains unresolved after the spotlight moves on. This is After the Headlines, because the story doesn't end when the news does.